All right, I am here in Charlotte, North Carolina, and check out this view from our hotel pool. Now, I've talked about them in several states along this road trip, but ET Family Travel has booked out all of our experiences here on this road trip, and they have been absolutely incredible. So like Medicare agents, it doesn't cost you anything to use them, but they have booked out all of our hotels, Disney excursions. If you're looking to travel, check out ET Family Travel. They have been an incredible sponsor for this trip and made this all happen. But you're not here for that. You're here for Medicare in North Carolina, so let's talk about that. Let's start with the supplement plan side of the conversation. Now, Medicare supplement plans have three different ways that you can rate them. So the first is community rated. This is not based on your age. A 65-year-old is paying the same as a 105-year-old. The second is issue age. This is based on the day that you are issued your Medicare supplement. So if you are issued it at 67, you're paying a little bit more than if you were issued it at 65. So there, your age comes into play. However, with issue age plans, your birthday doesn't matter once you're on the plan. So you're not getting an increase because you went from 67 years old to 68 years old on your birthday if you have this plan. So you're getting one increase a year with both of those plans, and that's for rising healthcare costs and inflation that most insurance companies just do every single year. Now, the third way to rate supplement plans is attained age, and this is by far the most common way that plans are rated across the country, and that is how the plans are rated here in North Carolina. With attained age plans, your rates are dependent on the age that you have attained. So like issue age plans, if you go on Medicare at 67, you will have a little bit higher rates than when you were 65. The difference is with attained age plans is once you're on your plan at 67, as soon as you turn 68 and you attain a new age, the insurance company could give you a little bit of a bump in your rates. On top of that, you could also see the bump for rising healthcare costs and inflation. So you could see two increases with attained age plans. And a lot of people get upset by this, and I totally get it. So is there any advantage to attained age plans? And the answer is yes. Attained age plans start lower typically than any of the others. So usually it goes something like attained age plans, then issue age plans, then community rated plans in terms of a 65-year-old looking for your plan options. And we see that here in North Carolina. So nationally, if a 65-year-old were to go and want to get a Medicare Supplement Plan G, the average is $150 per person per month. Here in North Carolina, it's $120 per person per month. For Plan N, the national average for a 65-year-old is $120 per month. Here in North Carolina, it's $90 per month. So you're seeing lower than average Medicare supplement plan rates, which is where attained age is kind of advantageous. All right, the sun's getting right in my eyes. I'm going to move over just a little bit to change the view. All right, here's a similar but slightly different view. So in addition to those already low supplement plan rates here in North Carolina, the insurance companies that offer these plans have the ability to offer certain discounts, and I'll go over a few of them. So one of them is called a household discount. What we're talking about here is that let's say you and your spouse are on the same supplement plan insurance company and you both have supplement plans with them. Well, they'll give you a discount for that. And it doesn't mean that you have to both have Plan G. One of you could have Plan G and one could have Plan N. But the fact that you're both with the same insurance company and both have supplement plans, there are companies that will give you discounts for that. Another discount is if you're willing to wear a smartwatch like a Fitbit or a Garmin or an iWatch and sync that with the insurance company. It's called a wearable discount, and they're willing to drop their prices a little bit so that they can see that you're active and exercising, which will benefit your health. The last discount to talk about here is there is a discount called an annual discount. If you're willing to pay all of your premiums up front for the year rather than month to month, they're willing to give you a discount for that. So on top of your already low premiums, you could pay even less here in North Carolina. We talk about the supplement plan penetration rate, and we're referring to how many people choose a supplement plan as opposed to the other options like Advantage plans or FEHB, government plans, other options. Now nationally, the average is 21%. So 21% of people are choosing supplement plans of any letter. Here in North Carolina, you are right at that average. You're at 21% of you are choosing supplement plans. That's not me advocating for or against supplement plans. Those are just the numbers here. Now, you don't have any special rules when it comes to switching from one supplement plan to another. In most cases, if you're looking to switch, let's say that you have a supplement plan G and your insurance company's rates are increasing faster than the others, and you wanted to switch to a plan G with a different company, you're going to have to go through medical underwriting, and that means you're going to answer medical questions, and if your health is poor, they could raise your rates or deny you completely. If your health is good, the switch shouldn't be a problem, but if your health is poor, that's where you're going to run into some issues. Same thing if you want to go from a plan G down to a plan N, you're going to go through medical underwriting. Now, there is an insurance company here that will take pretty much anybody. However, their rates are going to be higher. As you can imagine, they're taking on more risk and their rates and premiums are higher than normal. To finish up with supplement plans, let's talk about those who are pre-65. So you're qualifying for Medicare because you're disabled, you have end-stage renal disease, or you've been diagnosed with ALS or Lou Gehrig's disease. If any of those apply, in most states, it's very difficult to find a supplement plan pre-65. Now, North Carolina, you're a little bit unique. You have all of the letters available, but they are considerably more expensive, like 3 to 5 times more expensive than those who are getting a supplement plan when they are 65. For those who are pre-65, once you reach 65, you do have a new open enrollment window where you can get on any of the supplement plan letters and you're paying the same rate that any other 65-year-old would pay. But pre-65, you're either looking at really expensive supplement plans or an Advantage plan or original Medicare only, or if you have some sort of employer coverage, either through yourself or through a spouse, then you're coordinating Medicare with your employer coverage. Now let's switch over to the Advantage plan side of the conversation. Now with Medicare Advantage plans, again, you're looking at the same trial rights and the same rules that you would see nationally. So there are 2 trial rates to know about. With an Advantage plan, the big knock here is that once you go on it, you can't go back to a supplement plan without difficulty. And that's not always true. There are a couple of things to talk about here. What it means is that you can't go back to original Medicare and a supplement plan without that medical underwriting that we're talking about. So you'll have to answer medical questions, and if your health is poor, switching becomes difficult. And that's usually the reason that people switch, is they're on an Advantage plan, something is going wrong, and now they want to pay more to have the coverage of a supplement plan, but with something going wrong with the health, it's hard to get on there. So there are 2 trial rights to know about. If you take an Advantage plan, and it has to be at your 65th birthday, so you're taking Medicare and an Advantage plan at your 65th birthday, you have a 12-month window to try out that Advantage plan, and if you don't like it, you can switch back to original Medicare and a supplement plan without any medical underwriting. Again, this is just at your 65th birthday. Now, the second trial right is at any age after 65, so if you go on Medicare at 70, and the first plan that you pick is a supplement plan, if at any time in the future you want to switch off of that supplement plan and onto an Advantage plan, you have a 12-month window to be on that Advantage plan and then switch back to original Medicare and your supplement plan without any medical underwriting. You only get to do this once. You can't keep going back and forth. Otherwise, the way to switch is to go through medical underwriting, or if you have a special election period. The most commons are if you move outside of your coverage area of your Advantage plan, or if the Advantage plan goes away because the insurance company removed it from the market. That sun's following me around again. I'm going to move one more time to finish up this video. You're just getting several different views of the Omni Hotel pool. All right, now the big number that we look at with Advantage plans is the maximum out of pocket. This is the maximum risk that you could face in a given year. Once you hit that number, the insurance company covers 100% of the approved charges after this number. The national average for maximum out of pockets on Advantage plans is $5,000. Here in North Carolina, your average is about $4,700. Now this is an average, so you will see plans that are higher, you will see plans that are lower, but in general, you're looking at a little bit lower than average maximum out of pocket rates here in North Carolina. The Advantage plan penetration rate nationally is 50%. Here in North Carolina, you're at 53%, so slightly above the national average. Again, neither of these are me advocating that you choose an Advantage plan or a supplement plan. This is just what we're seeing here in North Carolina. Now, with both of these plans, I highly recommend that you use an independent licensed agent who is familiar with your area. I'm not even saying that you have to use us. I'm just saying use an agent. It will never cost you anything to do so. They can compare and shop all of these rates. They can find those discounts on supplement plans if they're licensed with those carriers, and they can help you with the Advantage plan conversation as well. So if you do need help, my email is in the description of this video, or you can go to theretirementnerds.com. A note here on Advantage plans. So Duke Medical Center is a very highly renowned medical center. It does accept Medicare Advantage plans for now. The tricky part with Advantage plans is that doctors and hospital systems can drop off of them. So right now it is accepting some Medicare Advantage plans. Make sure that you're working with your agent to find a plan that has them as in-network and that is participating with them. All right, I like to leave secret keywords at the end of my videos. Here in North Carolina, what I think about is Michael Jordan. He was my hero growing up. So if you leave any comment that is related to your favorite athlete, then you and I will both know that you've made it at least this far. I get a lot of comments from people who didn't watch the video, and they're very angry. If they would have just watched the video, then they would have had all of their questions answered. Thank you for making it this far. If you haven't subscribed already, please do so. It helps more than you know. Me and my family are off to explore North Carolina a little bit more. I appreciate you, and thank you for watching. I will see you in the next one.